Did.
Good evening. Good evening. Welcome to Unmasked Virtual Town Hall Series. My name is Abba Blankson. I'm the Senior Vice President for Marketing and Communications for the NAACP. We are honored and excited about the experts and leaders for tonight's panel on the coronavirus vaccines and treatments, and we look forward to an informative and engaging conversation. If you want to stay involved with the NAACP or support our social justice work, you can dial *8 or go to naacp.org to volunteer. For our phone participants, if at any time you have a question, you can dial *3 to get in the question queue. If you're watching on social media, on YouTube or Facebook, you can leave us a question or comment at NAACP. With that, I'd like to introduce NAACP President and CEO, Derrick Johnson. President Johnson, the floor is yours.
Thank you, Abba, and I want to thank everyone who is joining us this evening. As you can recall, at the beginning of this pandemic, the NAACP, we embarked on a series of teletown hall meetings to ensure that our community will be educated and informed on how to navigate the global pandemic. We later continued that discussion as we realized that it was having a disproportionate impact on the African American community. And unfortunately, with this global pandemic, which was having a national impact on many of our lives, we found ourselves navigating in this space without a true federal response as a result of the current administration. We did our very best to keep the community informed about how best to protect your families, yourselves, and the communities that we come from. Tonight is no difference. We're going to close out the year with this conversation with some of the experts to assist you in understanding what lies in front of us with the vaccine. No, two vaccines. No, possibly three vaccines that is under consideration. One that has been approved by the FDA. Nor the history of the African American communities and our hesitancy in getting involved with medical experiments. We want to make sure that you are fully aware of how to navigate in this moment with the information as it is readily available. We are excited with the panel of experts that's going to be coming before us this evening, and I'm waiting to hear the sound device that we're going to receive. So thank you, Abba, for setting up this, once again, Teletown Hall meeting. And I
Thank you,
guess I'm the
President
person
Johnson.
to
With that, I'd
introduce
like to
April Ryan.
introduce
So
our
our moderator for
moderators.
this evening will be April Ryan, a friend, a member, and an activist with NAACP. So thank you, April, for joining us, and I'm going to turn it over to you at this point.
Thank you, Mr. President. Everyone, welcome to this Teletown Hall Unmasked COVID-19 Town Hall. This is a time where we are looking for information as these vaccines are being dispersed throughout this nation. Millions, tens of millions are infected in this country. Hundreds of thousands have died. And without further ado, I want to introduce our panel tonight. We will have joining us not long into the future, Senator Cory Booker of the state of New Jersey. We also have Dr. Patrice Harris of the American Medical Association, the immediate past president, who will be joining us. Dr. Marcella Nunez Smith, the co-chair of President-elect Joe Biden's advisory board on coronavirus. We also have Dr. Kamika Corbett, the Senior Research Fellow, Scientific Lead at the National Institutes of Health, Donald Alcindor, PhD, Associate Professor of Meharry Medical College, as well as Dr. Gigi El-Boyami. She is a medical professor at GWU, George Washington University, also the director of the Rodham Institute and a member of the Black Coalition Against COVID. Welcome, everyone. Thank you for joining us tonight. Once again, we are looking to inform, and we are looking for layman's terms because we can talk in so cerebral terminologies, but this is impacting people, and we want you to understand what's at stake. And I want to go first with Dr. Kamika Corbett. Dr. Corbett, you were in the lab working on this for the last 8-9 months. So can you tell us, as it relates to the disbursement of these vaccines, we have Pfizer, we have Moderna, and there's another on the horizon. What should we be looking for as we watch those who are the heroes in the hospitals trying to save us. What do you think we should be looking for as we watch these vaccines be dispersed?
Hi, and thanks a lot for this invitation. It's a pleasure to be here to engage with the community in this way. One thing that I do want to step back and just remind people is that the research that we've been doing that has really fueled these vaccines forward in how we consider it to be called rapid way or warp speed is long-standing, actually. I've been scientific lead of the coronavirus team at the NIH for 6 years now, since I graduated from graduate school. So the vaccine development that has been happening for the last several months is something that you're seeing in front of your eyes as something that's happening very rapid. But there's tons of science and data that not only backs what is being expressed by the vaccine, but also the platforms, at least the prominent ones, which are the mRNA platforms. So that's just one thing that I wanted to say. And obviously now we are embarking on this moment where the FDA is approving what are considered to be emergency use authorizations. So these are really special authorizations where the FDA says, with what the data we have right now from phase 3 efficacy trials, can we use these vaccines in some of the most vulnerable populations and those people who are at the highest of risk? And so as those people, like healthcare workers, people that are elderly or people with more than one comorbidity start to get these vaccines in these early rollouts, the things that you should be watching as you are deciding in whether you want to get the vaccine when it comes available for general public is how the efficacy data continues to stand, remembering that the phase 3 clinical trials are actually continuing to monitor people both from a safety perspective and also from an efficacy perspective. Remembering that my team actually personally is continuing to publish data from the preclinical side and also from the phase 1 clinical trials. So to continue to monitor the data that comes out. And if you know a healthcare worker or someone on the front line who is getting the vaccine, to ask those honest questions that people have been asking me, such as, what are the side effects? How did you feel after you got the vaccine? How did other people around you feel when they got the vaccine? Have you seen anyone become severely ill? Really try to get real world explanations on these types of things, because I understand actually that these FDA packets have tons of language in them. Very hard to decipher what it means, solicited, adverse event, et cetera, and it can be confusing. But I think that as these vaccines are rolling out, getting real life experience and detail of the experience of vaccine from people, that is probably the most important level of information that you can have.
So once again, if you want to join in on this conversation, please press *3, or send your question to Twitter. And Dr. Corbett, I want to stick with you one more second with one question. I'm going to go to Dr. Nunez-Smith. You talked about the emergency use authorization and that these vaccines are still in the third phase of trials. And we know from history, pharmaceutical companies take years in the lab. They take years with the studies, phase 1, phase 2, phase 3. What gives the average American, as well as those on the front line, the confidence that this will actually do the trick, that this will not cause something, side effect, beyond the normal issues of taking a vaccine?
So I like to categorize the answer to that question kind of two ways. The first is the science, right, which is where I stand as a scientific lead, having the data that helps to push the vaccines forward in this way. Over the last 6 years, we've been studying how to make the best and safe immune response for coronaviruses, actually. So that, and then also this moment is very different when you compare it to historical moments when vaccines have been developed. And one of the things that is very different is that the circumstances are extremely dire right now. And with that, different organizations and institutions, whether it be from the company side or National Institutes of Health, FDA, et cetera, came together and said, we have an issue. How can we streamline this process to insert different checkpoints along the way that have been the same checkpoints all the time in all vaccine development to ensure that the product that comes out of it at the end is safe and effective, but that we have not skipped one step at all. And so what that meant is that you had a lot of sleepless nights from a lot of different teams all over the country, whether it be from the regulatory side or the scientific side. And the other thing that it meant is that there were all eyes on deck, just as there were all hands on deck. I want people to realize that just because it has been rapid does not mean that there has been any level of irresponsibility in regards to this development. And in fact, the types of criteria that the FDA have been in a stepwise fashion putting into place, allowing the science to drive this, actually shows, in my opinion, that the system is working in the favor of the public. For example, understanding that most adverse events for following vaccinations in history have actually happened within the first 2 months following vaccinations. The FDA got that data together and they said, well, we were not going to approve any vaccine for emergency use until a median of the participants, so about half of the participants in the phase 3 clinical trial, have passed that 2-month mark. So this is an extremely data-driven and scientifically driven process.
And so the vaccine can evolve. So it's not necessarily this is it. It can evolve to something greater.
Well, I mean, I don't know how much greater you're going to get than 94.1 and 95% efficacy. But what I mean is that as these clinical trials have been going on since March 16th, actually, that was when the first person in the United States was injected with Moderna's vaccine candidate. As these clinical trials have been going on, that these stages of these clinical trials and the outcomes of these clinical trials and what the FDA requires to move to the next step has been driven by science and nothing else. And that's what I mean. And so what you're seeing now with these emergency use authorizations is that there's a solid amount of data from phase 3 clinical trials that inform the FDA around the safety and efficacy of these vaccines, so much so that they can say, we trust these vaccines to be used immediately based on 95% efficacy and no severe safety signals in any large amount, to be used immediately in these vulnerable populations so we can try to start to change the dynamic of the transmission in this pandemic.
Great. And we have Senator Cory Booker, Senator from New Jersey on. We just want to say hello to you first, and then we're going to come back. Senator Booker, hello, how are you? Okay, your mic is not on. Hello, Senator Booker.
I apologize, April. I'm sorry. I know this, newly talented, newly named Griot reporter. I got to bring my A game when I'm dealing with you. I apologize.
That's right. White House correspondent for the Griot. All right. Yes. So we will be back to you in 2 seconds, but I want to go to Dr. Marcella Nunez-Smith, co-chair of the President-elect Joe Biden's advisory board on the coronavirus. Can you give us an update, Dr. Nunez-Smith, as we currently are sitting in the vaccinations of frontline workers? Can you give us an update on what's happening and what you anticipate starting January 2021?
Perfect. Thank you so much. And it's great to be here with everyone. Thank you to NAACP for hosting this event. And if I might just to take a moment to say thank you to Dr. Corbett and your team and to all of the scientists who've worked so hard to get us to this place. And I really just want to echo, this moment of just great optimism and hope as we realize that not just one, likely 2+ vaccine candidates on the horizon, and that we start this week with vaccination for people who are on the front line and at great risk, as was pointed out. And I think it's a huge accomplishment. I feel very confident, as Dr. Corbett said that she does, and many others do, that the political interference risk was really removed we had scientists reviewing the data in terms of the vaccines and their signals around how safe they are, the efficacy, that's really how well they work, and that means how well they work in keeping people from getting very sick from COVID-19. So this is a very momentous time for us. We have to also balance this optimism and this light at the end of the tunnel with the reality that at the moment we are in great surge across the country. We are meeting and breaking just the most grim of milestones. And so even as we recognize the vaccine and the promise of the vaccine as one important tool in the toolbox, we have to really be thinking as well about all the things we know that we have to continue doing in terms of keeping our mask on, small groups and gatherings, social distancing, washing our hands frequently, all of that. And also, I think, keeping our eye on the promise of more available increased testing, the ability for people to be able to, if they need to, quarantine and isolate at home and try to remove barriers for people who now aren't able to do that successfully. For us to keep our eye on new therapies on the horizon. And I think for the Biden-Harris team, it's a great honor for me to be here really representing the reality that everyone is centering the work on equity. And there's a commitment to equitable and efficient distribution of the vaccine. But we're also keeping our eye on things like testing and things like treatment. We have to ensure equity in those domains as well.
All right. And Senator Cory Booker, I want to go to you next. There's been a lot of lessons learned in this moment as it relates to how to handle this life and death situation. What is Congress prepared to do? What's the Senate prepared to do come January 20 when the mentality and the people and leadership change as it relates to making sure that this 70% to 80% of Americans are actually vaccinated?
Well, April, it's great to be on with you tonight. And for the second time, we were on earlier talking about a bill that I have called Justice for Black Farmers, and had a chance to talk about some of these very important conversations, which makes me want to thank President Derrick Johnson all the more for not just his leadership during this pandemic, but for making sure that we are staying connected to each other with real talk and invaluable information. And so when it comes to Congress acting, we know that when Joe Biden swears his oath to become the next president of the United States and Kamala Harris the next vice president, we're going to still be in the middle of this pandemic. And in fact, we will be probably deep in crisis as we're seeing hospitalizations right now reach record highs and deaths per day reach staggering numbers, how this crisis has already become the third largest mass casualty event in American history. And unfortunately, we know that this mass casualty event is affecting vulnerable populations, Black and brown communities, Native communities. And this is something that the Biden-Harris team will have to be taking on front and center in their agenda. And us in Congress at the same time, we are control the purse strings. And what I've been pushing for is really robust funding, especially for those jurisdictions that are most in crisis, to be able to distribute this vaccine. We need to make sure that state and local communities have the money to get the job done. And as the medical officials on this panel can probably speak to better than I can, there are a lot of logistics that really go on from getting a vaccine from a plant into someone's arm. States and jurisdictions are going to have to get the resources they need to recruit and train thousands of healthcare workers, to modernize data and tracking systems, to stand up vaccine sites, and so much more. Without that robust funding, I fear that some places will see similar hiccups and barriers that we did and still do as we try to roll out a comprehensive testing regime. And so we know that when these barriers are erected or the challenges are faced, they're most difficult when it comes to Black and brown communities and low income and poor communities. And so I want you to know what I'm calling for, which is that those more resources to empower local trusted organizations and communicators as we move forward. And so I'm grateful for people like Sandra Lindsay, the nurse who was the first person to receive the vaccine in the US, and Dr. Corbett here tonight for leading and the development of the Moderna vaccine at the NIH, who are among the many Black women who are leading this fight. And I want you to know that this past June, another member of the Congressional Black Caucus, Congresswoman Robin Kelly, and I introduced the Community Solutions COVID-19 Act, which would create a grant program to help grassroots organizations create and expand upon programs to eliminate the inequities that are so prevalent in our healthcare outcomes as it relates to COVID-19. And I'm hopeful that our bill and similar legislation can not only be included in the stimulus package we're working on right now, but can be part of the empowering resources put forward so that the Biden-Harris team from the executive branch could help us to really meet the challenges of getting ourselves out of this pandemic here in the United States.
Do you have buy-in from Mitch McConnell and Republicans?
Right now, we're in the midst of negotiations, and I'll be frank with you. We do not have the buy-in to do this at the level that we need to. Where we are negotiating right now, around $900 billion, is far short of the resources we need to meet the extent of this pandemic. And you're seeing the numbers and the areas being covered. Some of them are good, but they're not to the degree we need for food aid, not to the degree that we need for our hospitals, not to the degree we need for our state and local governments. We're not seeing the level of resources and funding we need in the midst of this crisis. And as I said to you on our Instagram Live, April, we are the wealthiest nation on the planet Earth, but our peer nations from Japan to Germany are doing so much more. We're arguing over a package of about $900 billion. And I think that Japanese just finished a package for a much smaller country of over $700 billion. We are not putting enough resources out there. And I'm hoping, this is why Georgia is so critically important, because if we win in Georgia, then soon to be President Biden and Vice President Harris will have a Senate better positioned to help them to do big things, not only to help deal with the immediacy of the pandemic, but also to help us, as he says, to build back better, to make strategic investments so that our communities can not only deal with the health crisis, but also the economic crisis and turn this dark period into one of light.
And so let's just be clear, some of that funding that you're talking about would actually go to the NIH to help Dr. Corbett just further study this issue, this deadly virus that we are in the grips of right now, correct, Senator?
Right now, there's not that much money for the NIH really being discussed, I'll be honest with you, and not adequate. And I think there's something, and this is where I know Kamala, because I've worked, Vice President-elect Harris and I have worked together on these issues. I'm trying here. April and I have been having a talk about this. You go from somebody who's your colleague and your sister who to now
you got to give him the title. Give him the title. Give him the title.
She more than earned it, and she's going to become one of our country's great history makers very, very soon. But she and I have worked on these issues of racial disparities in healthcare outcomes and healthcare access. And I'm confident from my conversations with Joe Biden that this is going to be part of their agenda. This COVID virus, is laying bare the deeper inequalities, structural inequalities in our country that have to be addressed, not just for those who are suffering the disparate health outcomes, but if we are together to be a successful nation, we cannot have large parts of our population have such inequality when it comes to healthcare outcomes and healthcare access.
All right, well, let's go to questions. We've got a lot of people who have questions, and we're still going to ask questions of our panelists. Press *3 if you have questions. You are joining us for the Unmasked, a COVID-19 town hall. I'm your moderator, April Ryan, White House correspondent for The Brio. Abba, let's go to a call.
Yes, April, we have Rowena with a question. Rowena, you're on live. Go ahead with your question.
Yes. If someone tested positive because and they have a natural immunity, how long does that last, and should they still get the vaccine?
Okay. Who can answer that? Let's go to Dr. Gigi El-Bounyami.
That's a great question, and the reality is we don't know exactly, but the current recommendations is to go ahead and immunize even if you've had the COVID virus itself. This is the part where we're learning, and I just want to add to this idea of why should we trust the vaccine. And as a member of the Black Coalition Against COVID, I would really direct you to our website, blackcoalitionagainstcovid.org, because these are questions that will be answered with more scientific and clinical information. And so please keep an eye on that. It is being studied right now. Right now, it's felt to be in the range of maybe 2 to 3 months because, when we are able to measure the antibody, but the jury is still out.
Dr. Alcindor, I want to ask you that as well.
Can you hear me?
Yes, we can. Yes.
Yes. So some people will not make neutralizing antibodies. Well, some people will. Coronavirus is in terms of duration of immunity can be short-lived. And so this is a question that has to be answered in the future, but they want you to get the vaccine. And the reason being is that if your neutralizing antibody has waned over time, getting the vaccine is likely to boost your immune response further and offer you protection that you did not have or has waned during the natural infection process.
Well, there's also a concern about those who could be allergic to this. Um, who is at risk? Who should not take this? Who would like to answer that, please? You know what? I'm going to go to Dr. Corbett. Because you're in the lab with it. I'm going to go back to you, Dr. Corbett. We have celebrated your excellence. And I say that, and I want to give you your flowers because I say to people, I said, this is not the first time Black people have been in the lab. And it's been before Charles Drew, but we celebrate you tonight. And I want to go to you. Who should not be taking this vaccine?
Right. And I actually want to just piggyback on what was previously said about the antibody response, actually, because we published a slew of data alongside the phase 1 clinical trial data where people who got the vaccine, 100% of people got whopping neutralizing antibodies. So these are antibodies that have the ability to kill virus. So if you get vaccinated, it's likely that you will be in the 100% of people who have really high levels of those, as opposed to after natural infection, about 1/3 or 1/4 of people do not get those types of antibodies at all. And so you're really playing Russian roulette with natural immunity as opposed to more guaranteed immunity from the vaccine. So I just really had to drive home. I'm a scientist, so I'm all about driving home the data in a very dissectable way. And then regarding the allergies and the anaphylaxis that has been seen following some of the initial immunizations with Pfizer's vaccines, is that these people had history of severe allergies. And unfortunately, a large subset of those types of people were not in the phase 3 clinical trials enough to make any generalizable type of recommendation around people with severe allergies. And so as we get more and more data, I'm sure that the FDA will inform people on whether or not, if you have severe allergies, whether or not you should get the vaccine. Right now, the recommendation, at least in the UK, is that you should not get the vaccine if you have severe allergies, or at least be prepared with your EpiPen if you so choose, because again, all inclusively, getting vaccinated is always your informed choice. And so this is something that is not really a cause of concern because it happened in people who had a history of these types of reactions, whether it be from severe food reactions or allergies, etc. And it did not happen in just your normal person who had never had any allergic reaction before.
Okay, thank you. All right, so let's go back to the phone lines. People are really, we've got a long line of questions, and that's just showing how much people are engaged in this moment. This is a life or death moment. So, Abba, let's go to the phone line.
We have a question from Lusby, Maryland, or Linthicum, Maryland. Go ahead with your question.
Hi, good afternoon. Good evening, everyone. I have a three-part question. I'll make it real quick. My question is, with the release of various vaccines from several manufacturers and rather quickly, what are the differences between them? The second question is, do you have the option of which to take, or is it random based on where your vaccination is given? And then the last question is there tracking of which vaccination individuals are given in case there are future side effects that need to be treated?
Dr. Harris, those are excellent questions. Dr. Harris?
Those are excellent questions, and I will probably defer to Dr. Corbett on one. But April, you mentioned something at the very beginning of the hour that I think is very important, and this session is about information and data and science. And I'm so glad that everyone's engaged, because the folks on this call are giving you data and science with which to make your decisions. I also just have to take a moment. I am a psychiatrist, and I know there have been lots of issues around mental health raised during this pandemic. And my patients and others have asked, what can we do? The one thing I recommend is don't miss the moments, those moments of hope and inspiration. And so, April, you've said it already about Dr. Corbett, and I'm so honored to be on the panel with her, and she certainly deserves our praise. But I think it's important to see her and hear her as we discuss issues around mistrust. And I think it's also important that we elevate Dr. Nunez-Smith. I was moved when she spoke from the platform of the presidency, the president-elect, and the vice president-elect, and amplified terms that we've heard before, but I think made so much more powerful because of the platform, minoritized and marginalized communities. That's how we should be talking about this. She talked about the social determinants of health. She talked about structural racism. And so I think it's important that we appreciate the context of all of that information as we discuss COVID-19 and vaccines tonight. So two of the vaccines, of course, and Dr. Corbett worked on one of these, use messenger RNA, and I will let Dr. Corbett talk about the scientific aspect of that, but I think of it in a very lay terms. And these vaccines teach your body how to respond if and when you were to encounter the real virus. And so they make sure that you're ready. It's a protein. It's not the virus. It's just a piece of the virus. We've all seen photos of the virus with that protein. And so your body is then prepared to fight off the coronavirus if you should become infected. And the third, yes, and so I will turn it over to Dr. Corbett to give information about the third vaccine.
Yes, Dr. Corbett, I'm going to go back to Dr. Gigi as well on this as well. Go ahead, Dr. Corbett, yes.
I'm assuming that you all are talking about the AstraZeneca candidate, which also is only using the same piece of the coronavirus, which is it's called the spike protein. So it's just one protein from the virus, not the whole virus. The cool technology around AstraZeneca's candidate, and actually also Johnson & Johnson's candidate, while we're here and talking about it, is that they take the guts out of a normal cold virus called an adenovirus. So they remove all of the material that would make it an effective virus, and they put that spike protein inside. And so basically they're using the outside of a common cold virus to express a coronavirus spike protein. So the common cold virus kind of alerts your immune system. And then once your immune system is alerted, the spike protein is there, so it can teach your immune system what the spike protein of a coronavirus looks like. So that's the really nifty trick that AstraZeneca and Johnson & Johnson are using.
Okay. And Dr. Gigi?
Yes, I think that one of the things about this new virus is that it's very sneaky. It kind of comes in and the body is not really able to detect it. And that's why it can be so devastating. So, as was mentioned, it is about teaching your system to react to it, to contain it. I wanted to just add a couple of things which are so important in assuring that the people who are currently suffering from COVID or who might get infected before they get vaccinated is that things like food matter. Food is one of the strongest social determinants of health and mental health specifically. Don't forget to make sure that if you have other conditions such as diabetes or HIV or chronic conditions, I actually just completed my cancer treatment for kidney cancer, that you are controlling everything that you possibly can. And then let's not forget about other vaccines that are available. Influenza, of course, and pneumonia vaccine, because what you don't want to happen is to get the flu, which makes you susceptible to getting another virus or another infection. But I want to underscore something which really has to do with trust. I think that you are seeing this illustrious panel that represents a variety of different groups and expertise. And to see that Black people and people of color are involved and are keeping an eye on exactly what's happened is super important and should really bring trust. And I'm happy to say that with these educational forums, the acceptance rate for getting a COVID vaccine among African Americans is actually beginning to increase. So let's keep that dialogue moving.
Well, I think you hit the nail squarely when you talked about a trust issue. And I want to throw that out before I go to the next question with Alba. In the Black community, there is an issue of trust. We know about Tuskegee. We know about so many other issues when it comes to health. We also know about the health disparities with the races in this nation as it relates to just going to a doctor and getting the right diagnosis or having the right kind of follow-up care. I'm throwing this out to anyone who wants to answer. What would you say about history versus now when it comes to trust in this vaccine as we are in this emergency use authorization moment? Anyone?
Well, I will
That's why the
in
Black
April.
Coalition against this is why the Black Coalition Against COVID was started by Dr. Reed Tuckson, former DC Health Commissioner, as well as former president of Charles Drew. It involves the 4 historically Black medical schools, as well as sectors of labor and education, as well as business. And so having a group that really is dedicated to assuring the best quality care, vetting information about clinical trials and vaccines, I think is crucial because of this issue of distrust, mistrust, which
Yes.
I think everybody on this panel can certainly understand.
Dr. Harris?
Yes, and I always like to emphasize that this mistrust is earned. And so, just as the mistrust has been earned, we can certainly go in and earn trust, but we have to make sure that it's not a one and done proposition. Certainly, you see evidence of African Americans on this panel who are highlighting the science, highlighting our trust. I have said that as soon as it is my turn, I do plan to get the vaccine. But now we have to redouble our efforts. You heard our caller, Dr. Gigi, talk about another coalition of folks that are working on this. Of course, the NAACP, by making sure that we all get accurate information. And so I think we have to continue to do that. There are issues in the past, but there are issues in the present. And we need to continue to work in our communities during the pandemic, but we have to continue that after we get through this pandemic. And I want to highlight one other thing because I've seen a couple of issues confused. This mistrust that has been earned is not the same as the misinformation that has been put out there by the anti-vaccine community. So I want to make sure that people are clear those are two separate issues.
Yeah, you're right. Misinformation. And there was a study by the Knight Foundation and Gallup when it came to COVID. The number one piece of misinformation. Well, it was. I don't. I know that the president of the United States was number two. Social media was up there as well. And when you have mistrust or misinformation or both dueling together from the leader of your country, that causes a ripple effect throughout the nation that we've seen as well, because that goes to mask wearing. Now, I want to go back to Gigi. We need to, not Gigi, excuse me, Abba. We need to go to Abba and go to calls, because we got a lot of people. Let's go *3 if you want to talk, if you need information. This is an informative session. It's called Unmasked, a COVID-19 Town Hall. We are getting information. We have got the people here. We have got the doctor who is in the lab working with this. And we are so honored to have you, Dr. Corbett. We really are. And it's an honor to know that, as Dr. Gigi said, we have someone who looks like us, who's watching us.
You know,
and
actually,
watching for us.
I actually want to speak to that point, because you highlighted something that is important to note. Mind you, the history is the history, and the history is what got us to this point where there is this, what I would consider to be the onus of us, on the side of the science and the vaccine developers to earn the trust back. But some of the things that are different as you compare today to history is, number one, a large amount of effort was put into ensuring that this process, every step of the way, had the eyes of people of color in it. So Dr. James Hildreth, for example, the CEO and president of Meharry, actually sits on the board and is reviewing data packages from my own personal vaccine, tomorrow, to say whether or not it can get emergency use authorization. On the side of the science, obviously, I serve as a scientific lead for the National Institutes of Health team. And there are just tons of places in this process where the eyes of people of color. And also, one of the things, although I am completely not a fan of the misinformation, but one of the things that social media has done is that it has heightened the accountability. So one of the things that became very clear, particularly, and I'm just going to speak from my own personal standpoint, is in our phase 1 clinical trial, only having 4% of African Americans in the phase 1 clinical trial was actually the only embarrassing thing that has happened for this vaccine effort from my standpoint. And so at that point, it became clear that if we were going to be able to sit on panels like this and tell people of color that the vaccine is safe and effective for them, that we needed to increase the representation of those people in color and people with comorbidities, et cetera, in the phase 3 clinical trial. So Moderna started first because we helped to drive that product into phase 1 clinical trial in 66 days. But Moderna's phase 3 numbers were not on par with where we would like to have seen them. And so Moderna's CEO actually agreed to slow down enrollment so that we could get better representation of people of color in the phase 3 clinical trial. And I actually looked at the FDA package when I was reading it, and I was just happy, actually, because it was at about 6% Black enrollees in the phase 3 clinical trials. And it was like, no, we're pumping the brakes and we're going to at least try to get up to 10%. Could it be better? Yes, it could match the population of this country at about 14%, but we aren't there yet. But what I want people to understand is that we are at least trying. And I also want people to understand that it is at no fault of yours that you do not trust a system that has done you and your ancestors wrong for hundreds of years. And that the questions that you ask, as long as they are respectable and they come from a place of genuinely caring about your health and the health of your community, I think that it is on us to continue to answer those questions in forums just like these. And so I just wanted to point out just a couple of very small things that are different. But, people are like, why does it matter that she's Black? It matters because I'm getting invitations from everybody in the world right now to come talk to them, via Zoom to their group of scientists, and I have said I am not taking absolutely any invitation until you can tell me that the community is invited. I have Caltech inviting the community. I have Harvard's inviting the community. That is why it matters that we are embedded in this process so that our work not only fuels the development of these vaccines and these treatments, but also that our work shines and so that our community is just as informed as everyone else.
Wow, Dr. Alcindor, we just heard something so major from Dr. Corbett. That was impacting.
Yes.
Let me tell you, that was newsworthy, what you just said.
Yes.
It was very newsworthy. Dr. Alcindor, listening to Dr. Corbett, she's basically saying that, things have changed since years ago with the mistrust in clinical trials for us. Talk to that issue of Black people now getting involved in trials for our own collective good, for issues not just for COVID, but sickle cell, which there's still no cure for, other diseases that impact us greater than the other communities.
So when this pandemic started, we felt that the historically Black colleges had a very important place. It was a call to action for historically Black colleges. And Meharry joined on June 30th the Vaccine Trial Network. And they were going to enroll community members in a study of vaccine candidates as a part of Project Warp Speed. And I did come in and started to serve as a community liaison, as a dissemination specialist, as a person who was both a scientist and a person that would meet communities where they are, meaning that I was originally trained as a molecular virologist, and I would go into barbershops and salons, and I would go to churches and talk to retired military and all of those people and find out what their needs were in terms of questions they had about a vaccine. And so as part of Project Warp Speed, Meharry is in the process of participating in a clinical trial. We are there to protect populations against COVID-19 and to be a proponent for the health and wellness of communities of color. And so at Meharry, we have 3 testing sites throughout Nashville. We have testing laboratories that have been supported by the Gates Foundation and Thermo Fisher Scientific. The targeted populations are populations from our community. That is, people with underlying medical conditions, people that have a greater risk of exposure at their jobs, people that work in elderly care facilities, people that are older than age 65, folks that work in prisons and jails, and of course, indigenous populations, including African Americans and Latinx people. Our recruitment goals have been met about 85%. We're trying to get 300 people. And again, we have compensation for some of those folks if they complete the trial. We want to target this idea of the fears. And so we tell the patients that they don't get infected with this SARS-CoV-2 vaccine, and you can't come down with a COVID-19 illness if you get the vaccine. And of course, the interest I want to say out is that anybody living in the Nashville area that is interested in participating in our trials, please contact Dr. Vladimir Berteau at 615-327-5753. The vaccine is given in 2 doses, that's 21 days apart. If you plan to get the flu vaccine, you should get the flu vaccine at least 5 days before you get our vaccine. And so you are followed for 2 years. You're given an electronic diary that you can document every type of adverse event you might have. And of course, you have to give blood samples quarterly. And so this is something that's very important. There's another issue that I want to bring up tonight, and that is there's a number of people that are infected already. And we know that a vaccine will not help people that are already infected. And so you have to have other kinds of treatments for people that are hospitalized. And one of these treatments that we have been involved with is the Pass It On treatment. This stands for Passive Immunity Trial of Our Nation. And again, this is sponsored through the Coordinating Center at Vanderbilt University Medical Center. This was funded by Dolly Parton and the National Center for Advanced Translational Sciences. They are set out to enroll 1,000 participants at 51 sites throughout the United States. They initially have 19 sites that are currently active, and they have 395 participants that are currently enrolled here in the US. The trial is designed to include underserved populations that are at the greatest risk for developing the more severe symptoms of COVID-19. And again, if you are injured in any way by this vaccine that can be directly proven, then you and your insurance would not have to pay. You would be able to get treatment at Vanderbilt for any kind of adverse events.
Well,
And again,
thank you.
the treatment will be convalescent plasma. And convalescent plasma is plasma that's taken from a person that's recovered from COVID-19. And that can be used because that plasma has antibodies to the SARS-CoV-2 virus that can help a person that's sick and in a hospital recover. And so
Thank you so
this
much. Thank you so
convalescent
much,
plasma,
Dr.
okay.
Dr.
Thank you.
Asunda. Thank you so much. That's good information. And it's also important to note that there are schools, HBCUs, Xavier, as well as Dillard in New Orleans, two schools in New Orleans that the presidents are part of trials as well as pushing the students. And we want to get to the phone one more time, at least one more time before we conclude this impactful, important, informative town hall session. Abba?
We have Linda in Bloomfield. Linda, go ahead with your question.
My question has to do, what is the youngest age in which you recommend either one or any of these vaccinations to be given to young people? And are there methods where, you know, some public school systems do have nurses and doctors that go out because the children don't always have any more medical care other than just at certain grades where they have to take their immunizations, period?
All right, thank you for the call, caller. Who would like to answer that question?
So I will answer that question. The
Yes, sir.
CDC recommends 16 and over for the Pfizer vaccine. And as of now, the Pfizer vaccine is the only one that has been given EUA. So 16 years old and older. In Pfizer's study, they did include younger people as young as 12 years old in their study, but there was too few of those individuals who were that young. And the CDC is authorizing 16 years and older for the Pfizer vaccine. And I think it's clear that in the future, probably just like every other immunization for children that go to public school, you will probably have to get this COVID-19 vaccine before going to public school in the future.
Wow. So, and I want to hit a couple of points. Dr. Gigi, we were in conversation not long ago, and what people don't understand, COVID is such a destroyer. If you can go into some of the information that you were talking about with COVID, about how there is a cognitive issue. We're finding later on that there's a cognitive issue with some younger people as well who get it. Also, that there is, months later, there could be some organ issues. Can you speak on that synopsis of a synopsis if you can?
Of course, of course. I think that one of the very negative roles that the administration has played is to really downplay the effects of COVID. Yes, there are people who are asymptomatic, and yes, there are people that really don't have long-term or midterm kinds of consequences. But we know that there's a subgroup of people. It seems to be more common in women, and we're learning why, that have what's called the long hauler symptoms, which include continued chest pain, continued episodes of shortness of breath, as well as brain fog. We know that 50% of people who infected with COVID, we're learning, that can have the heart affected. We don't know yet how long these symptoms last. And we have some previous experience with other viruses, such as the viruses that cause chronic fatigue, for example. So some of these long hauler symptoms, we're projecting that they may last as long as 2 years. So the downplaying of oh, it's just a mild thing and most people are going to do fine, are not true. Now, you add people with chronic medical conditions such as HIV. There was just a paper that came out, I think today, cancer, active cancer treatment, asthma, diabetes, etc. that those risks of having severe disease and dying from the disease are significant. You can get blood clots to the brain, you can get blood clots. You just heard that the former or the chief of security at the White House just had part of his leg amputated from a severe COVID infection. And the few children that get infected with COVID and seriously infected are actually super, super sick. So, these are, I don't want to scare people, but I just want to put in perspective why we're talking about vaccines today, why we're talking about protecting yourself, why we're talking about physical distancing, especially during the holidays, mask wearing and hand washing.
And this is why I respect Dr. Alcindor so much through this whole call. He had on his mask. Thank you. And that's what we have to do. It's not a joke, but we literally have to find the protections, to keep ourselves safe. And I want to go back to you, Dr. Nunez-Smith. Vice President elect, not Vice President elect, President elect Joe Biden wants people to wear masks. It is not a mandated thing, is it? Or tell me about this, because this is a lifesaver. Talk to me about this effort that he wants us to go through wearing a mask once he comes into office.
Yeah, absolutely. Thank you so much. The president-elect has asked us all to make that commitment to continue wearing a mask. We know that people are tired so many months into this. We call it COVID fatigue, and everyone wants to get back to normal. But we're looking for a new normal on the other side of the pandemic in this Build Back Better world. And for us to get there and for us to get their safety, we have to continue to do some of these basic public health things, such as wearing our mask. The kind of mask that you wear does matter as well. So I want to encourage people that as we're talking about masks, it's not just any face covering. And we want to make sure that you're wearing a mask that is at least 2-ply. It could be cloth or not, but avoid things like the fleece covering or putting a shirt up only. It's really important that we are very consistent in how we wear the mask. Too often I see people walking around in stores and other places where the mask is below the nose, for example. So you want to cover your nose and your mouth at all time. And really and truly, it's whenever you're outside your home or even inside your home, if there is someone who is high risk. In our house where, some of us have to leave and we have a multi-generational home, as so many do, we wear masks in the house to help keep the folks safe who are high risk who live in our house. So the mask, we have great evidence there. The data are there. The mask will save lives. So we're asking you, the president-elect is asking, this isn't a mandate. This is about the generosity and care that we have for ourselves, our loved ones, our communities, our families, and really our healthcare workers. I beseech everyone as a practicing internal medicine doctor that we should all do our part to help protect and preserve the healthcare system. And that is about the doctors, the nurses, the respiratory therapists. When we wear the mask, we honor and respect them as well. So just a little bit longer, we're asking people to continue doing those things, to make that sacrifice, to have a socially distanced but happy holiday season this year.
Thank you, Dr. Nunez-Smith. I want to go back to Dr. Corbett. I keep going back to you because you are our promise for this moment. And I'm asking you, listening to Dr. Nunez-Smith, the reality. 70 to 80% of people must get vaccinated for us to breathe easier, maybe take off the mask. How long is that going to be? And please give us the unadulterated truth.
One of the things that really stood out from what was just said is that she talked a little bit about just the selflessness of wearing masks and how sometimes it might not be about you, but about the people that are around you that are more vulnerable, etc. And that's actually how I think about vaccines too. I get a lot of, I'm not really in the high risk category. And if vaccines really work, then why do you even need more people to take them? If you take it, then why do I take it if vaccines work? Vaccines work when there are a large amount of the population that gets vaccinated, as was just cited, 60 or 70% of people in a population that is vaccinated that can create what is called herd immunity or population immunity. So basically what this does is it really just impedes the level of transmission in the community to the point where the virus that's causing the pandemic or the outbreak starts to die out. So what my fear is that we will start to see herd immunity in certain communities, but might not be seeing herd immunity in other communities. And so then the pandemic stays alive in some communities and starts to die out in other communities. And those communities where the pandemic is still running very rampant might be forgotten in the long run. And so
So does
I
that
like to
mean
think
it needs to be
about
global? Does that mean
vaccination needs to be something that is equitable, as Dr. Nunez-Smith put very eloquently. In order for vaccination to really work on the level of which we want it to work, to really get us back to the place where we can live our normal lives again, vaccination needs to be equitable. And also remembering that some people just cannot get vaccines. For example, right now, children cannot get vaccinated because they haven't really been fully tested with the vaccines. The FDA hasn't approved it for them. You know, there are vulnerable populations that might fall out of vaccinology, right? There are people who have very severe allergies, right? We're finding out that they might not be the best candidates for vaccines. And so you getting your own personal vaccine is not just about preventing disease for yourself. Getting vaccinated is about doing your part to be someone who cannot really take up the space in the dynamics of transmission in your community. That is really what vaccinations are about at the end of the day. And so I think that is probably the best closing point that could be made around this entire conversation around vaccines is that, you know, when you are living in this type of event, this pandemic, sometimes, and by way of just getting us out of it, the actions that you take, whether it be wearing a mask, socially distancing for, you know, the holiday season for 1 year, etc. Sometimes those actions are you stepping outside of yourself and just saying, let us all just kind of get through this together so we can get to the next stage and get to what I actually want to be a new normal. Because if we're gonna rise above, then let's rise above and actually be better than we were before. But yeah, vaccines are not just about you, but they're for your community.
I thank you for that. I thank you so much. Well, tonight, everyone, this has been such an informative conversation. Unmasked, a COVID town hall. We've learned so much from Senator Cory Booker, Dr. Patrice Harris, American Medical Association, Dr. Marcella Nunez-Smith, co-chair of President-elect Joe Biden's advisory board on coronavirus. Also, Dr. Mika Corbett, Senior Research Fellow, Scientific Lead at the National Institutes of Health. I cannot say that more. The Scientific Lead. We are so proud of you. Also, thank you, Dr. Donald Alcindor, the Associate Professor of Meharry Medical School, Dr. Gigi El Bonyami. She is the professor at George Washington University. Also, she's the director of the Rodham Institute and the member of the Black Coalition Against COVID. President Johnson, I'm going to turn this over to you. I've learned a lot tonight, and this has been something that our people need, all people need. It's about information. That's what I try to do, disseminate it, and there you have it.
I want to make one quick comment.
Thank you.
Yes, sir. Go ahead. Real
Yes,
fast.
and the comment
Synopsis of a
is
synopsis.
that for typhoid, it took us 105 years to get a vaccine. For poliovirus, 47 years. I just want to say to Dr. Corbett, thank you for your service.
Amen. Amen. Amen.
Right.
Take us to church now.
So thank you,
Mr. President.
That's right. Thank you, April, for hosting this wonderful conversation. The NAACP, we're committed to bring this type of information as this global pandemic has had an impact on how we move about. And as we approach this holiday season, some of us will not be able to celebrate with our loved ones in present. But as we've held this virtual conversation, we must also take the precautions necessary. I love what Dr. Nunez said. Be kind to your neighbor. Wear a mask. That's the kindest thing you can do in the midst of this. And I love the last statement where it was said that vaccinations need to be equitable. And it's about equity is what we do as NAACP and sharing equitable information as we navigate in this moment. For the NAACP, we thank all of you who have joined us this evening. This has been a wonderful, wonderful conversation. I have learned a lot. I have readjusted my thinking around the necessity of getting the vaccine. I hope you have shared in learning so much from this wonderful panel. If you look at the panel, it looked like the Black community, and that's what I'm most proud about. Have a wonderful holiday season. I hope that we can reconvene at the top of the year of 2021, which is going to be so much better than 2020, so that we can continue to share this great information and move forward as a collective whole to make democracy work, to keep our communities safe, and to ensure our families are healthy. Good night.
Good night.
Good night.